My name is Bill Gagnon. I came to Envita. I came here to be treated for prostate cancer. I had no idea that this was going to happen. And I was kind of blindsided, to be perfectly honest. Before that, I mean, life was pretty normal. You know, just working and going on vacations and having a good old time. You know, grandkids and kids. And all of a sudden, just have a physical and PSA levels high. So do another PSA test and came back higher a week later. And so then they wanted to do an MRI, and we did the MRI and found a spot. Then we had to come back and they had to take biopsies, and they did 15 biopsies. One came back positive out of the 15, so which was just positive, but still not what you wanted to hear. So we met with the surgeon. I'll be perfectly honest, the surgeon there was very unprofessional, in my opinion. He's just sat back in a chair, arms crossed, all laid out, Crocs on, and just tell me what he's gonna do. I mean, they didn't want to listen to me, you know? And when we would bring something up, they were like, nope, you can't do that. Nope, you can't do that. And they only gave me two options. They said full radiation or robotic knife or robotic surgery. And they were not open to anything else. This is what we're gonna do, and we already have you scheduled. And my wife and I looked at each other and nope, this is not gonna happen. That's when we called Envita and they wanted me to come in. We ended up talking to Missy, and she's fantastic. She's awesome. Yeah, she just said, you know, come on down, and then we scheduled that appointment. And like I said, it was fast. I mean, we came here, like I said, within 2.5 weeks, I think, of finding what they wanted to do back in Minnesota. Dr. Coffin, we met with him. He is great. He sat down and talked to us and asked us what we wanted to do, asked us what we thought would be the proper way to go. They drew the blood, they ran the tests, and they said, we're gonna do this and this and this, but we're not gonna do this because this is not gonna work for you. You know, even though this is what everybody else wants you to do, we're not gonna do that. So it was amazing how the medication that I was on, it wasn't like it was a one size fits all coming here. It was specially to your body. You know, it's amazing. After I came back, after they drew all my blood, his exact words to me were, we're sitting in the room talking about what they're gonna do. And he looks at me straight in the face and says, this is going to be a slam dunk, okay? Don't worry. One thing that really intrigues me about the whole thing of Envita is you have one doctor that you see, but you have a whole panel of doctors that meet to talk about you know, just you, and then the next person, but you know, they all meet and just discuss you. That's what's more refreshing. It's just not one person's opinion on what we have to do. They all get together, and that's really cool, really cool. What amazed me the most, I think, of everybody at Envita is once you were there for, like, let's say 3 days, you came in, everybody knew your first name. Hey, Bill, hey, Bill. I mean, I didn't even meet half these people before, but they knew who I was. It was amazing. I didn't have a name badge on, you know, but yet they knew who you were, and that's very important. You weren't like a number or a piece of cattle just going through the you know, the motions, I guess. You know, they treat you like a human being. They get to know you, you know, and they monitor you constantly. I mean, they are fantastic. I mean, they are fantastic the way they don't leave your side, or, you know, you're not a number, and there's not a one size fits all. So when you come here, they specialize the treatment to you, and that's very important. This whole experience down here was amazing to me. It's not like any other place or any other medical facility. I would recommend anybody to come here. This place is absolutely fantastic, and they care for you. They really, really care for you.